Arthritis is nasty. It is progressive, it is degenerative, it is inflammatory, and we have no cure for it. So arthritis is a condition where the cartilage inside the joint starts to wear out, break down, and that can result in significant pain, swelling, ultimately deformity. The only thing that we can do for it at this point is treat the symptoms of arthritis, and usually part of that is going to be with medications, which may have potentially dangerous side effects. And then at the end of it all, if symptoms are bad enough and patients have failed conservative treatment, then they end up with a total knee replacement, which is kind of a big deal. So in this episode, I'm going to talk about the 3 best supplements that you can take to prevent the symptoms of arthritis, potentially prevent the progression of the arthritis, and maybe if you don't have arthritis, maybe help prevent it at all from happening. At the end of the episode, I am going to give you the 3 most important things that you can do to stop the symptoms of your arthritis. So I'm Dr. Brad Homan, board certified orthopedic surgeon. Please like and subscribe if this is interesting information for you. So let's dive in. The first thing I'm going to do is talk about arthritis, what it is, how it progresses, things of that nature. So inside the knee joint, the bones are lined by cartilage, and the cartilage is sort of a layer of a cushion. And inside that cartilage is what we call chondrocytes. These are the cells that create the cartilage and maintain the cartilage. So osteoarthritis tends to occur as we get older, and sometimes it's related to a trauma when the cartilage actually becomes damaged from an injury. But in most cases of regular osteoarthritis, it happens to be an age-related process. And what kickstarts the whole thing is the cartilage cells, the chondrocytes, as they get older, first of all, become less effective in maintaining the cartilage matrix. So they can't upkeep the cartilage and keep it strong like they used to because they're losing energy and they're not doing quite as effective a job of keeping that cartilage strong. And so over time, as we weight bear on the joints, that cartilage will start to become damaged. And the other part of the second thing that the cartilage cells do as they get older is they start to secrete inflammatory chemicals. And these inflammatory chemicals will actually start to eat away at the cartilage matrix, or the normal cartilage, causing it to sort of weaken, soften, and fragment. So then you've got these little pieces of cartilage that are floating around inside the joint fluid, which is called synovial fluid. And those eventually will start to get to the edges of the joint, or the lining of the joint, what we call the synovium. And those little particles will start to cause inflammation of the synovium. So then the synovium responds by secreting even more inflammation into the joint, which has 2 problems. Number 1, it breaks down the cartilage even more. Number 2, that normal, viscous, thick synovial fluid becomes damaged by these inflammatory chemicals, and it becomes less effective, more watery, and that puts more pressure on the cartilage. And so once this process gets started, it is just a back and forth downward spiral until ultimately symptoms are bad enough that they need some kind of a treatment. So the 3 best supplements to treat the symptoms of arthritis are going to be number 1, curcumin. So curcumin is made from something called turmeric, and it is a very potent anti-inflammatory. In fact, in many studies, curcumin has been shown to be as effective as non-steroidal anti-inflammatory medications. And so curcumin is probably the most potent anti-inflammatory that can help reduce your symptoms of joint inflammation. Number 2 is going to be glucosamine/chondroitin sulfate. So these 2 are typically found together in joint health supplements, and the reason that they're on the list is they've probably been the most widely studied out of all the supplements. So glucosamine and chondroitin are components of joint cartilage. And so the thought process here is, if you're ingesting these components of cartilage, it's going to end up in your cartilage and make it stronger. Whether or not that happens very effectively is sort of up in the air. I would tell you that most of the research shows about a 50-50 effect. 50% of patients taking these supplements tend to notice improvement, or 50% taking the supplements tend to have good x-ray findings. And I find in clinical practice also with my patients personally, I would say 50-50 is about right as far as whether or not patients feel a difference when they take glucosamine and chondroitin. chondroitin. But this has been studied for decades and it's got good research, and so it makes the list at number 2. Number 3, omega-3 fatty acids. That's going to be like your fish oil. So very potent anti-inflammatory. It helps with circulation, so it helps preserve that joint cartilage. So those are going to be the top 3 supplements that are going to improve the symptoms of arthritis. I do want to throw out a few honorable mentions because there still are some other supplements that are showing some promise. Boswellia serrata, bromelain, and collagen are 3 that are on the list as far as potentially having an effect on either strengthening the cartilage, improving the circulation to the cartilage, and reducing inflammation. Also on that list is CoQ10. So CoQ10 not only improves circulation, but it also helps ramp up the mitochondrial function in the cells, meaning like the energy of the cells. So potentially CoQ10 could strengthen up those cartilage cells and prevent them from getting aged and secreting those inflammatory chemicals. Vitamin D is a big one. So vitamin D is important for bone health, cartilage health, muscle health, all of it. And many patients are vitamin D deficient and don't even know it. So one of the greatest ways to get vitamin D is to be outside in the sun and with diet. So if you're inside working all the time, you might potentially be vitamin D deficient, which is definitely going to be a problem for your joints. Boron is on the list as well. It's sort of an up-and-coming supplement, which can be very effective in reducing inflammation and symptoms of osteoarthritis. So those are going to be the supplements that are going to be the best bet for you and your arthritis, either treating the symptoms or maybe preventing progression. Now, the 3 most important things that you can do to prevent the symptoms of arthritis have nothing to do with supplements at all. In fact, number 1 is low-impact strengthening exercise. The muscles and tendons and ligaments that surround the joints are actually the support for the joints. So think of it as the symptoms of arthritis occur because of the impact and the pounding on that cartilage. The muscles, tendons, ligaments that surround the joints actually are sort of a shock absorber for the joints. They support the joints and take that impact down. So you have less impact on the cartilage, less damage on that cartilage that will cause the prevention of worsening. The second thing with the exercise is that loading that cartilage with a non-impact type of exercise or putting pressure on that cartilage with normal exercise strengthens the cartilage. Part of the problem of arthritis is that cartilage becomes weak, it starts to fragment, but regular loading of that cartilage keeps it healthy and keeps it from getting weak and fragmenting. So, low impact strengthening exercise, number 1 thing you could do to make the symptoms of your arthritis better. Number 2 is going to be your dietary habits. So basically that's eating clean, eating healthy, getting inflammatory stuff out of your system. So a lot of things that we know that we ingest cause inflammation in your body and can make inflammatory conditions like arthritis worse. And that would be like added sugars, preservatives, additives that try to make your food taste better or feel better in your mouth or whatever. All of these chemicals that are added to our foods are inflammatory, and they also can help prevent your body from the healing process that you need to treat these symptoms and prevent them from getting worse. Number 3, weight loss. We have an obesity issue in this country, and if you're overweight, it's putting more pressure on these joints. And so losing weight can help prevent the symptoms of arthritis. So those are the 3 best things that you can do. Those are the 3 best supplements that you have. I hope you enjoyed the information. If so, please like and subscribe, share with your friends. I am Dr. Brad Homan, and as always, my message is take care of your body and your body will take care of you.